The first speaker is simply DL. I think everyone knows him. But I'd like to also say, why would DL be given, asked to speak on evidence-based approach to improving immunity to manage cattle health? And I think DL is probably the poster boy for evidence-based. So, DL, go ahead.
All right. Thank you very much, Dr. Grodelution. I just needed been brought to our attention an announcement. Someone lost a telephone. So I will hand this over to Dr. Grodelution, and if it's yours, it was out in the hallway, and he'll have it in safekeeping. So I assume voice is okay there and back. Everybody can hear me okay? All right, thumbs up. I love to see that. Again, I want to say appreciation and thanks to the committee for inviting me to share some of the information that we have today. And I do want to just make a comment. You noticed on the very front slide, there's also Dr. Clint Crable. He's the gentleman in the upper right-hand corner. But we have a very, very unique situation at Oklahoma State University in which there's a lot of collaboration with animal science, with the diagnostic lab. Several of these individuals, Dr. Tony Comfort, Dr. Robert Fulton, and then also our grad students, because they put a lot of time and effort in, and we have several of them that are going on into the industry. So what Dr. Willems requested, and Dr. Chase, evidence-based approach to improving immunity to manage cattle health. Or I guess another way to start putting this or to approach this, or maybe a better title, be things I've observed about trying to prevent respiratory disease in these high-risk beef calves. So some of the goals for today, they're going to be real simple and straightforward. KIS, keep it simple. I'm going to talk a little bit about vaccination versus revaccination. So 1 dose versus 2, which is a common question out in the industry. And then also talking a little bit about some of these preventive health programs and what some of the outcomes are getting these animals on in to their different phases of production into stock or into feedlot. The preference always is to ask questions and have fun and share experiences, and we will be able to have that opportunity at the very end of the session. So, starting out with the very first one. Challenge that the industry is that we all face, and we're aware of this, is that feeder calf supply. It's short right now, but we acquire a lot of these calves out of the southeast. They come from very, very small farms in which some of them, I remember when I was in industry traveling, and when Tennessee, I think, got up to 14 animals per herd on an average, they were extremely excited that they had increased to that level. So we have a lot of these small herds, and of course we have to group them into similar sizes, genders, types, maybe even colors, phenotypes, in order for them to come on out in a distance of traveling to the plain states. And a lot of times, basically, it's an unknown health history. The comment that comes even to us sometimes on a piece of paper, or the comment when the trucker unloads, hey, these calves have had all their shots. And the question is, what's all their shots mean? And what I have found out, it's not uncommon. That means they've had 1 dose of a blackleg shot, a 7-way. And the progressive producers in the southeast will use an 8-way blackleg shot. So, as you're all aware of that. So, the practical approach, and we've talked a little bit about this with immunity and some of the challenges that we have, but our practical approach is we'd like to try to increase the level of immunity in this group of animals, and the practical approach is through a vaccination type of program, in the hopes that we'll have some of this immunity such that when those animals, the challenge is being circulated around to the various pathogens, they'll be able to handle it, and hopefully we will have less severe clinical signs and hopefully less death loss in the animals. Challenge of this approach, though, is these calves are stressed, and we really don't know exactly, are they going to respond optimally with an immune response or not. And from a practical standpoint, there's not an easy approach that any of us can apply to say which animals did respond to a vaccine and which ones did not. So hence, the thought is maybe go ahead and give 2 doses of a viral respiratory vaccine frequently a modified live in our area, in the hopes that the ones that did not respond on the first dose will respond on the second dose that's administered at some point in time. So basically we're going to compare a single dose of a 5-way viral respiratory vaccine to 2 doses in a receiving or a preconditioning period. And then we took those calves on, and I'll explain a little bit in materials and methods. Then we're going to see how those animals would hold up when, in a finishing type of a setting, those animals would be exposed to a natural challenge with or through persistently infected BVDV calves in the pen. Disclosure or thanks, Intervet Animal Health helped support some of this study. And we started out basically 600 head of crossbred beef cattle. Average, they were 5 weights, 483 pounds. You can see up there we had a little over 200 bulls and almost 400 steers, and we stratified those. They were from multiple auction markets, primarily out of Arkansas and Oklahoma. Then they were randomly assigned to one of 2 treatments. The SVAC, or SVAC, they're the ones that received a single dose of viral vaccine. And then the REVAC, or REVAC, they received 2 doses. And there's no data that I am aware of, controlled data, that is analyzed where if you are going to follow a REVAC type of program, we hear anywhere from 7 days to maybe 10 days, some people 10 to 14 days. So we just kind of went in the middle, and we went on there and set 11 days apart. Okay. After 60 days in a preconditioning period, went on ahead and shipped them to a research feedlot where they had the Grow Safe system, and that's where we included PI-BVD calves in the pen for the entire finishing period. At the feedlot, those groups, we had SVAC and REVAC, that was a preconditioning period. Half of each one of those groups either got vaccinated or they did not. So basically, this is what it looked like. So half of the single vac and half of the REVAC were vaccinated again at feedlot processing, and then half of the single vac and half of the REVAC were not vaccinated. So we could see how the animals would hold up. Average days on feed was 157, went to a commercial processor, and the typical carcass characteristics we evaluated. So here's the results, and we'll kind of divide this up into 2 phases, the preconditioning or the receiving period. And we also looked at if we left deads or removed into the analysis, or if they died or were removed from some health issue where we took them out. And the bottom line is we did not see any type of difference that we could measure. Body weight in average daily gain, this is included. Dry matter intake and feed to gain is the same. And this section right here is if those deads are removed, were excluded from analysis. And again, no difference in those animals. One thing we did notice, though, is that the morbidity rate was slightly different. And if you look at this first column here on your left, total morbidity and then BRD-related morbidity in the single vac was actually less than in the REVAC group. But I'm going to caution you on one thing about that, is that those animals, our average on polls occurred before they received the second dose of viral vaccine. And I'll repeat that in kind of some of the conclusions on this. But there was that one difference. In the finishing phase, it's always very nice when we try to design or develop a protocol, a preventive health protocol. If it seems to work out, we always appreciate that. They don't always. But the nice thing about this, the individuals that the pen writers and the veterinarians involved in the finishing phase of this study are very, very well versed in observing cattle, and they did not observe any animal that had or exhibited clinical signs indicative of clinical respiratory disease. So that was a good thing. Did not see any difference from our typical performance parameters, average daily gain, final body weight, or dry matter intake. The revac ones, that was interesting. One thing that did show up and was statistically different is they had a lower feed to gain, or basically a better conversion, feed conversion through the finishing phase. And there you can see right there on that where the little arrow is, here's the revac group, and they had less amount of feed per pound of gain compared to the single vac. We did also notice in the carcass, the hot carcass weight, really there was no difference on that. However, the one thing, there was a little bit difference in the marbling scores on that, in which the single vac, no vaccination, and the revac and vaccination were higher than their counterparts. Okay. So conclusions on this first study is preconditioning program did have a benefit into the fact that we did not observe, or the individuals observing these animals, clinical evaluators, did not observe any animal exhibiting signs of respiratory disease. There appeared to be some protection against BVD, and that could have occurred either through the different marketing channels. Those animals may have been exposed, even in shipment, or where they originally came from, the farm of origin, which they could have been exposed to a PI BVD animal, or what again we'd like to say is our vaccination programs work. But we do have to look at it both ways. It could be natural exposure or through vaccinations. No differences in performance in the preconditioning period. One thing that we did do that was different, we want to acknowledge, is when we brought those animals up for the revac, we did not bring the single vac group up. And the reason for that is because, at least anecdotally out in the field, we get comments, we don't want to bring cattle up through the chute because it will affect their performance and those calves never catch up. We did not identify it, at least in this particular study. Revac morbidity was higher than the single vac in the preconditioning period. You can see those numbers up there, but remember the important thing in evaluating this information is that those animals averaged under 8 days, I think 7.2 and 7.6 days to the first treatment, so that it primarily occurred prior to getting that second dose of modified live. Morbidity occurred before that time, probably just a randomization. And no significant differences in treatment success, chronic rate, or mortality rate. And there in your proceedings is where that information in more detail is available for you. The second one I'd like to visit a little bit about on managing health and immunity in animals was looking at commingling and stress, and those two words have been brought up since yesterday morning at our symposium. So we all pretty well acknowledge or accept that there are very two stress components involved with these animals and affecting what the performance is. So we'll discuss a little bit about some health management practices or preventive health protocols along with commingling. And evaluate calves, ranch of unknown origin. Disclosure and thanks. Again, would like to thank Noble Foundation because they did help support in some of this, provided some of the funding in support of this particular study. This one had about 500 head of animals. About half of them are market calves. Those are calves that originated from auction markets. They would not have any history on them, health history, coming to us. And then we had one ranch, and the ranch was very, very nice. He wanted to know the answer to this question, so we took his calves and basically divided them into 3 groups. And there are about 249 steers for that. The auction market calves, or the market calves, there were 3 order buyers that assembled these animals over 2 periods of time. 3 order buyers. One was in the state of Georgia. One was, I believe, Tennessee. I can't remember where the third state was off the top of my head. It could have been Alabama, Mississippi. But those buyers purchased calves from many, many different auction markets, and then they were shipped to another order buyer facility in Mississippi. They were commingled again and then put on the trucks and shipped to us in Stillwater, Oklahoma, at Oklahoma State University. At the ranch of origin, at about 2 months of age, these calves had, in our particular area, if calves are going to be handled or processed at an early age, at what we frequently refer to as branding time, they'll get a blackleg shot or a Clostridial Bactrim / toxoid. It happened to be a 7-way, and all the males were castrated, and anything with horns would have been dehorned. Okay. So, in dividing these animals up from the ranch of origin, we have 3 groups. One is weaned. So, the day that the calves were weaned, roughly a third of them were put on a truck that day, separated from their dams, put on the truck, on the road, and shipped to our facility there at the university. Another third, weaned back 45, they were weaned and would have followed a typical preconditioning program. And the preconditioning program we followed is referred to the Oklahoma Quality Beef Network. It's our state program. It's been well received and has shown some real benefit for farmers and ranchers. Basically, they're weaned wherever the facility is at, the farm or ranch of origin. 45 days is the magic number. They are administered a modified live viral respiratory vaccine, in this case a 7-way blackleg shot, a Mannheimia hemolytica toxoid, and then they got a revac, which was at 14 days. The question that we also had is, we've talked about all these different stressors, how stressful is weaning to the animals? And Dr. Hilton had mentioned a little bit about this yesterday morning, and we've visited quite a little bit through the years. We think it's very, very significant. So we took a third of these calves, and basically the day of weaning, they did not get any vaccinations, no viral pathogen vaccines were administered, and then they were basically raised on the ranch for 45 days. So that's the wean 45 down there at the bottom. At the end of the 45 days, the producer was kind enough, he actually paid for 2 separate semis, so those animals were never commingled from the day that they were weaned. Okay. The other thing, we kind of approached this a little bit differently into the fact that we looked at the market steers as our controls, compared to a lot of people like to look at the preconditioning ones. We've got a lot of experience with these high-risk calves. It's what we're noted for, and we anticipated a lot of illness, a lot of challenges with those animals, like we've discussed through the last day and a half, and so that was our controls in these animals. Once we got these animals at our research feedlot, we kept each group separate. We had, and I'll show you a table here. In November, we took half of the market steers, half of them stayed together, then half of them got commingled with the wean, or the ranch origin calves. The ranch calves that came in, half of them stayed with themselves, and the other half got divided up. And then 45 days later, we shipped those out, and when we brought in the wean vac 45 and the wean only for 45 days, when we mixed them together, we just refer to those as com or commingle. And here's basically the chart. You can see ranch, market, and then when we combined them, it was commingling. If you look over here, then we had wean 45 plus market, wean vac 45, wean vac 45 plus market, and then we kept market. So we did have a control the way we looked at both times in this particular study. Protocol was just like described with the OQBN and description of the wean vac 45 at the ranch of origin, in which those calves, all market calves, got processed that same way. The wean calves, because they were loaded on the truck, shipped to Stillwater, they were vaccinated again twice, and the wean 45s. We also kept, so that we did not have any nose-to-nose contact, we maintained at least an alleyway in between treatment groups, or we had a pen space, depending upon what we had available. And here's kind of an aerial view. I want to thank Dr. Bob Smith for this. This is a picture he shared with me over the years. So to the top of the screen is east, and we would have one group of calves. We'd bring them down the east alley into the processing area, and then back, same way over here. And then a different treatment group we'd bring down the middle alley, so that we never had any nose-to-nose contact or cross-the-fence contact. So basically the results, what would we normally anticipate, and did we have some animals that had to be removed? Yes, we had 14 of them due to severe respiratory distress. All of those animals originated from the market or the multiple auction market through the different order buyers. 2 in November and 12 in December. And of the ones that were removed, we did have 8 of them that did succumb or were euthanized. And again, a typical representative picture up there in the corner there of severe fibrinous bronchopneumonia or pleural pneumonia. We had 15 of them that we did have to remove due to lameness, or we commonly refer to those as the cripples. 5 of them weaned and 7 market ones in November. That was the first group. And then we had just 3 market ones in December. We did whatever the condition was. We looked at them. We were pretty aggressive on treating them. And all of them, fortunately, did respond to treatment, and they were able to be shipped on to the feedlot. Okay. Look about some of the differences that we observed in the weaning management. So right now, and I'll have some different slides, and I'll try to point this out as we go through. Over here's market on your left-hand side, and then the different weaning type programs, weaning management here in the different columns. Wean right off the cow, off the dam, onto the truck to the facility. Wean 45, no vaccines at the ranch of origin, and then wean back 45 were vaccinated at the ranch of origin. The interesting thing, and I'll bring this up also in the conclusion or summaries, we're not exactly sure why, but for some reason the wean back 45 steers came in heavier, and it was a difference. We don't know why, but I want you to go ahead and note on down here by day 42. And the reason 42 is it's because of a weekly interval. So when we have our crew and say we work calves on a Tuesday, all right, 4 Tuesdays from now you need to be back here and you're going to be this responsibility in this 6 weeks. So that's why 42 is in there, but we did keep the calves for 45 days. Okay. Morbidity, something that I think that a lot of us kind of want to look at. Now right here, we're going to be dividing up origin. So ranch calves, that's all ranch calves combined. Market, and that's when they're in their pens with themselves. Market, those are the multiple auction market derived animals with unknown health histories. And then commingle. Morbidity was 11% on ranch calves, about 42% or almost 4 times that amount for the market calves, and then kind of an intermediate number, about 23% pulls that met our case definition on the commingled animals. And you can kind of see that that was just the treated once, twice, or thrice, 3 times reflects those numbers. An interesting thing, and I think this is something that is very helpful and to us to at least consider when we're trying to help managers and owners. Most everybody, at least that I deal with, your clients, our clients, have challenges getting enough labor. And not only quantity, but quality of labor. So one thing that was kind of interesting on this, if you notice, our market calves in this study was 7.2 days. And that's not uncommon for us. We see a lot of pulls early on in about that 8-day period of time, and that's been a consistent number over several years. But if you look at just ranch calves here, that's right at 18 days. That's a nice opportunity in which facilities, operations are a little bit short on labor. You can help direct what available labor there is, employees directed at the ones that are going to be at higher risk. It doesn't mean to neglect these other animals. It just means if you're real short, you might be able to use that information to help focus where your resources are. And in the commingle, we're kind of intermediate in that at about 11 days. Mortality, we talked about this in the results. The calves that did die or did succumb or were euthanized were all of market derived. We did not lose any ranch calves, which was nice. Okay. Dividing up and looking at, well, what about just weaned calves? And you can also put this into some of the cost. But basically, there's that 42% with the market origin calves. Weaned calves, statistically, there was no difference from the market ones. These are the ones that just loaded right onto the truck and shipped. They were at 35%. And the nice thing about calves that were at least weaned at the ranch of origin had a very, very low percent. Again, a lot of clients that we deal with, if they get, quote, preconditioned calves, they want zero illness. But we know we're dealing with biological systems. That's not the case. So the difference in that 6 and 9.5% is one animal. But that's just the numbers that we're dealing with. So again, yes, we do have some illness, but it's not very much. And again, the nice thing, the number of days, there's that 7.2, and then we're out at almost a couple of weeks or so for the others. Cost-wise, again, just kind of looking at some of these ranch calves, $13, $13.50 for wean was average cost. Healthcare cost, $8.50 roughly on any animal that was at the ranch of origin for at least 45 days. Did not notice any difference or did not measure any difference in hot carcass weight or quality grade of the animals, which is nice. We did have a difference in our yield grade. It's not much, but again, probably dealing with larger numbers and some of the larger operations that a lot of us deal with. This could be a little bit significant depending upon the grid. Ranch calves did have a higher yield grade of about 2.6, and market calves was just under 2. Okay. Already mentioned this. Don't know why, but the wean vac 45, so wean plus vaccinations on the farm of origin for 45 days shipped to us, they arrived heavier. We tried to minimize and get rid of as many confounders as we could, but just being honest, we don't have an answer why those animals were heavier. We do know at the end, though, of the receiving period, those animals caught up, and there was no statistical difference in the amount of weight in those animals. Average daily gain, ranch calves that were not commingled did actually gain more than commingled animals. Market was very similar to commingle. There could be, again, some genetic potential differences in those animals. It was from one farm or ranch of origin, and they did have pretty nice looking calves phenotypically, and they had some history on those animals, and they did perform well. Okay. Morbidity, highest, and again, remember, is right at 42%. In market animals, the least in the ranch calves overall. This is one thing that we hypothesized, that when we put the ranch calves in with market calves, it's going to make the ranch calves sicker, if I can use that word. We're going to have a higher morbidity rate in those. And we actually didn't. It was kind of an intermediate level, and that was something that was a little surprising to us, but it's kind of something like, well, this is kind of interesting into the fact that maybe even use this as a management tool. Again, you got to kind of weigh on what your clients have as available resources. Again, the average days to first pull is something that I think is beneficial for helping with labor management. Healthcare cost, combined the market and the wean, was a little over a $13 bill, and is about $8.50 for anything that was weaned on the farm of origin. So there was an economic benefit with those animals. Similar benefits of the wean vac 45 and wean, which was good. We were hoping that weaning by itself was significant in the outcomes of these animals, and it was. Commingling may be less potentially negative effects when added with preconditioned calves. And there's where the information is with this. And then one thing that they requested that I share with you are some of my thoughts. So this is it's not my attempt. I got to give Nancy and Emily credit for doing the slides. But there's a famous saying about opinions. You guys heard opinions are like smiles? Everybody's got one, and they're all just a little bit different. So trying to make this nice. So here's kind of my thoughts in summing things up. Develop every one of your protocols based on the individual situation. In other words, customize your recommendations when you're developing your preventive health programs. Remember risk, and this is something that you may need to remind your client. So I'm trying to be a little bit funny here, okay? we understand high-risk calves, we're going to have, more than likely, we're going to have illness, and we're more than likely going to have some animals that will die. Sometimes, even though some clients may be buying these calves, if they get one group of calves, or maybe, 1,000 head that do fairly well, and we're down to maybe in the low 20s on morbidity and, 1 or 2% death loss, and then the next one that comes in, we're at 7 or 8 or 10% death loss and 60% pulls, then sometimes you need to remind them, remember what happened a year ago. So we've run into that situation frequently. Outcomes, I think, frequently reflect the level of attention to detail by individuals handling the cattle. And Dr. Tom Knopfsinger has made that comment, and I'll show you a next slide that I think kind of will sum that up a little bit. This has already been brought up. I had made this particular slide prior to coming here, but this has been mentioned at least twice before. But I think the industry can improve on the health and well-being of these weaned animals. And then this is kind of one of my sayings. Try and help people focus on where the calf's going, not necessarily where it's coming from. So my last slide I want to share with you, this is just a feedlot steer. I know you're never supposed to give them names. This one is nicknamed Pedro, and he would actually drink coffee with me. And I've only had 2 steers in my entire life that would ever do that. So with that, I'm right on time, and thank you very much.